Hello and welcome to my presentation on centering women's voices, understanding values-based leadership among women leaders in Uganda's health sector. By way of introduction, I am Lorna Muhirwe, current country director for One World Health Uganda, a scholar practitioner and global health advocate, and proud to be a fellow WomenLift Health East Africa 2025 cohort. My project objective is to document women's values-based leadership in healthcare setting. It's a qualitative study, and the idea is to capture lived realities shaping ethical and equitable decision-making by women leaders. The theory of change is based on the structure, processes, and outcomes model, with our values representing the structure within which our leadership decisions are made, which in turn influence our leadership processes, leading to ethical and equitable outcomes. I'll just pause for a spotlight example of a values-based leader. This is Dr. Jane Ruth Acheng, Uganda's Minister of Health, who has been recognized for values of clear communication, stewardship, and human-centric leadership. She's known for leading with conviction, prioritizing evidence and national interest, even amid political complexity. And this, when we talk about values-based leadership, this is the kind of leadership we are talking about. So why this study? In Uganda, in our healthcare workforce in Uganda, women comprise about 70% of the workforce, but are underrepresented in leadership. And we know that leadership in general is shaped by gender norms, by institutional patronage, ethical washing, and constrained autonomy, which might be quite challenging for women in particular. So this study responds to the gap, linking values-based leadership, health governance, and program outcomes with a focus on the voices of women in leadership in the health sector. The methodology is qualitative, so I will be conducting qualitative interviews with women leaders across system levels from community to national level. I'll be conducting interviews with at least 2 leadership development organizations, and my participants will be given a chance to share audio reflections capturing ethical dilemmas that they face as women leaders. In terms of outcomes or early results and ongoing evaluation, I have obtained ethical approval for the study from Uganda Management Institute's Ethics Review Committee. I've also submitted a pre-study commentary for publication to a special issue of SSM Health Systems Journal, and I'm awaiting feedback on that. My next steps are to complete data collection by December 2025, complete analysis by January 2026, develop an insight brief for dissemination, and possibly a manuscript 6 months down the road. In terms of leadership growth, I feel this study has really brought out issues around authenticity, inclusivity. In terms of authenticity, I'm able to capture leadership insights grounded in lived experiences of women. And in terms of inclusivity, I hope to ensure that voices that are captured represent different leader types, institutions, and contexts. The impact that I expect from this study is to generate reflections that shape personal leadership practices and strengthen leadership effectiveness, particularly for women in leadership. I hope that the momentum can be sustained through continued advocacy, dissemination of the findings, and organizational uptake of any recommendations from the study. What support is required from the audience? I would appreciate support in terms of connection to platforms and networks for sharing these findings broadly. I thank you so much for your attention.